Hello guys, hello friends, I hope all is well. Alright, so what I'm going to do, we're just going to hop right into chapter 16 with the bones and injuries of the wrist and hand. Okay, so you have 5 metacarpal bones, okay, and 14 phalanges. Alright, now the joints are named exactly where they are as far as location of the body, as we mentioned before. Half the time these ligaments, the joints, the bursa, they're named almost exactly in relation to their location. So just bear in mind in terms of the interphalangeals of the fingers, primarily the fingers, when we're addressing the bones in the hand. So we're going to move on to the bones in the wrist, or your carpal bones. Alright, so I put together a list here that shows the names of the bones. Okay, from anatomical position, it goes laterally to medially, distally to proximal. So basically, where you want to start outside in. Okay, going outside in, you got 2 rows of carpal bones and a total of 8 bones. Okay, so if you want to put together a mnemonic device to remember those 8 bones, by all means you can if you would like. Okay, or you don't have to. Maybe you just want to remember the name. Okay, the most important bone that you want to remember, and it's the most susceptible to injury, is your scaphoid bone. Now that is located right underneath the thumb. Okay, and since it's so close to the surface and kind of close out to on the lateral side, it just exposes people to injury of that specific bone. Okay, as I said, by all means you can create your own mnemonic device. I used to use a mnemonic device, but I noticed that it was a little bit racy, so I kind of changed the wording a little bit. Okay, and as I said, 2 rows. Once you hit 4 bones on one row, you're going to go back to the next row. Okay, and you're going to do the same thing. You're going to go laterally to medially, okay, outside in. All right, so when you're looking at a diagram as far as the bones are concerned, now you'll notice, as I said, it goes outside in. You're just going to simply some lovers try. Let me see. There you go. And then we have pizza. Alright, so you're wondering, why is there no arrow looking at, the pisiform bone of the wrist? Partly because the hand is turned down. Okay, so you're facing you're simply facing the opposite side of the hand as to why you can't see that. Now, if you were to face it in anatomical position, as we talked about being the reference point, that's where you can see it. So as I said, be mindful. Just kind of take some time out and just make your own mnemonic device about the carpal bones in the wrist. It is not a test question to know all of these bones, but it is a good idea to know them. But I will say that a test question would be, what is the bone in the carpals that is can't even talk today. What is the bone in the carpal bone that is more than likely to be injured in the wrist? So something of that nature. Whew, it's been one of those days. It's been one of those Mondays. But anyway, so that's just something to be mindful of in terms of the bones in the wrist, or your carpal bones. All right. As I said before, oftentimes ligaments and joints are named by the location of where they are. Okay, so you want to think about all the ligaments in the bones. Now, it is to each their own to memorize all of the names of the ligaments. Okay, and same thing, you'll discover in the ankle there's a lot of ligaments to remember. So but don't be afraid. I'm pretty sure later on we'll go over the ligaments, but it's just so you know, as a reference point, generally ligaments tend to be named, or joints tend to be named by the location of which they are located in the body. Okay, so like I said, just going right into it, think about every sport that requires gloves, or think about an activity that might require support of the wrist. Okay, so I'll give you a second, think about it. Sometimes weight training might call for protective wrist gear. Surprisingly, as I used to bowl, bowling does call for wrist gear, wrist and hand gear. So think about it. Think about all the sports or activities that require wrist and hand support. One of the things I was thinking about, as we talked about today in the lecture, is football. I'm telling you, football feels like you have to be covered from head to toe. Still a great sport, but very much so looks like you have to be covered from head to toe to be able to participate. But rightfully so. When you got a 300-pound person charging after you, you might want to protect yourself. Okay. You do and can get bone injuries. Generally, in this picture, that's an injury to the scaphoid bone. This is a closed wound. This is a big old bruise. Okay. Yeah. So generally, there's an injury right underneath the skin, and generally, this person might need to get in a brace to immobilize it. And yeah, this looks pretty bad. Okay. All right, so just going over different injuries and fractures. I'm going to go through them very swiftly, but you do have some injuries that are closely related to an activity that occurs for that person. Okay, so you might see in a boxing match where you might see the person's two back fingers kind of bandaged up. Okay, that is, is to prevent from when you're boxing somebody. Generally, these are the first two fingers that are exposed to injury in boxing. So that's just a method of protection. Not saying it's a piece of equipment. It is just a method to use to protect the boxer from those specific fingers. So let's see, we're not going to Cole's fracture so much, but again, because of the location of the injury, it's all about just being mindful of wearing that protective gear around the wrist, especially with Cole's fracture, considering that it's both the ulna and the radius at the same time. So how to remember the difference between your ulna and your radius is that your ulna is your pinky side and your radius is your thumb side. All right. Oftentimes when you injure your fingers or your wrists, range of motion is one of the things that are greatly impacted, okay? And when range of motion is impacted in the hand and the wrist, there is almost every sport, if not all sports, are limited to good biomechanics. So generally, with injury occurring, you want that athlete to get better so they can get back and play. However, it's just a good idea to sit them out and get them rehab so they can come back, especially with the hands, okay? Also, another way to injure your hands or your wrists, oftentimes it can happen with repetitive motion. Like maybe you type a lot, maybe you are a cashier, maybe you are a boxer or picker through maybe Amazon. So yeah, there's a number of activities that can impact range of motion and cause finger and wrist injuries just based off of repetitive movement. So, and tendinitis, okay, inflammation of the tendons, all right? So same thing, repetitive motion. Oftentimes when you see a lot of itises in the hand and the wrist, for the most part it can be just repetitive motion, just excessive typing, excessive scanning. So think of an occupation that might be excessive in its use, that might overuse the hand. So first occupation I think of automatically is a receptionist. So I'll give you a second to think about what occupation. Yes, for real. Think about an occupation that might hurt your hand. All right, so we got mallet finger, okay, right at the fingertip. You see where it says DIP joint? That is the distal interphalangeal joint, okay, because it is at that specific finger, the joint being in a distal position at the top of the finger, or at the top of the bone rather. Okay, mallet finger, you have your finger that drops in flexion. Okay, oftentimes in this particular case, you will have to have surgery, and a splint is required for mallet finger to repair it. All right, jersey finger. You're thinking, what in the devil is jersey finger? Generally, jersey finger is exactly that. Just imagine you're on the field playing and your finger gets caught in someone else's jersey. And that person and you are going in two separate directions. I never had it, but I can only imagine it being extremely painful. Okay, this is another opportunity to splint. X-rays are possibly needed, and swelling might occur, so could be the opportunity to apply prices to this method of this person's hand. Okay, boutonniere deformity is just a deformity where is the inability to extend at the proximal interphalangeal joint, or PIP. And in this case, a medical physician should be referred or sought after, and a splint is needed to repair. All right, so wrist sprains, common, very, very common, especially with the excessive use of our hands. Make sure you effectively tape or use a brace for that injury, and so that athlete can return to play. Dislocation of the lunate. We won't go into triangular fibrocartilage complex, but dislocation of the lunate. Remember, we talked about some lovers try. That's the second bone on in the first row. Trying to say it without confusing everybody. It's the second bone on the first row of the carpal bones. Okay, so you can injure the muscles in your wrist. Not muscles, excuse me. You can injure the bones on your wrist. However, to repair a lot of those wrist bones, you do have to immobilize the whole hand because of the location, as you can see, the location of the carpal bones. Okay, right above the ulna, right above the radius. All right, gamekeeper's thumb. Same thing. A lot of these injuries are named after the common activity in which these injuries are to occur. So they also call it skier's thumb. As you can see, thumb kind of gets caught because it's kind of just out there hanging out doing its own thing. But the funny thing is that you need your opposable thumb, so it's kind of out there doing its own thing, and it's so susceptible to injuries. That's why your scaphoid bone is very susceptible to injuries, because it's just hanging out there all by itself. All right, with ligament injuries, the best treatment for it, unless it's severe, is ice. Okay. If there's a possible injury, refer to the physician. Yeah, there isn't too much for me to go over because I have not talked about taping yet, and that's something I would like to get into before we talk about buddy tape for the prevention of ligament injuries. All right, last thing. Okay. You can dislocate the fingers, okay? But again, it's not something that you should try to fix, okay? That is the job of a physician because of the number of nerves and blood vessels, as well as disability in activities of daily living, okay? So important for a physician to diagnose and treat dislocated fingers and inflammation of any injury in the DIP or PIP joint in the finger. Okay, so that's all I got. Checking my notes, making sure I haven't missed anything, and I covered everything that I needed to. One more time, I'm going to give you the opportunity to look at the bones, the carpal bones, which, as you can see, is your radius, and it's your ulna. As you can see again, radius, ulna, radius, thumb side, ulna, pinky side. And seeing all the muscles in the, not muscles, I keep saying muscles, but it's one of these days. Bones. Bones in the wrist. It's probably time for a nap. You guys have a great day.